So we will discuss about the staging of cancer vulva. So in staging, first we will remember the broad headings in stage 1, 2, 3, 4, and then we will discuss the in details. So in simplify, the any malignancy in gynecology, it's mainly 4 stages: stage 1, stage 2, stage 3, and stage 4. This is according to FIGO staging. FIGO 2021. So stage 1 is called yearly stage. In stage 1, it is tumor is confined to vulva. So stage 1 is tumor confined to vulva. In stage 2, tumor of any size that extends to lower 1/3 of vagina, anus and urethra. VAU. So remember it as VAU. Vagina, anus and urethra, and with negative nodes. No node is involved. In stage 1, there is no node. It's entirely confined to vulva. In stage 2, it is tumor of any size but involving the vagina, lower 1/3 of vagina, anus and urethra, and with negative nodes, no nodes. In stage 3, tumor of any size with upper part of the involving to the upper part of the perineal structures. That means vagina, anus and urethra, and any number of non-fixed and non-ulcerated lymph nodes. Which lymph nodes? Regional lymph nodes. That is inguinofemoral lymph nodes. They are called regional lymph nodes for vulva. That is inguinofemoral lymph nodes. Then in stage 4, it is either the growth or tumor is fixed to bone, or the lymph node is fixed or ulcerated, and distance metastasis. So stage 1 means tumor is confined to vulva only. Stage 2 means any size of tumor with lower 1/3 of the vagina, anus and urethra. Stage 3 means tumor of any size involving the upper part of the vagina, anus and urethra with lymph node involvement, that is non-fixed or non-ulcerated lymph nodes, that is inguinofemoral lymph nodes. And stage 4 is, that is either tumor is fixed to the bone, or it is fixed or ulcerated lymph nodes, or distant means long liver bone. So coming into in details, stage 1 means yearly vulval cancer, that is tumor confined to vulva. So suppose there is a tumor, growth is here, this is the labia majora, growth is here, any size that so stage 1 is also, again it is stage 1A and 1B. 1A is tumor size less than 2 centimeter. If this is the growth and this is less than or equal to 2 centimeter. Remember, in vulva, cervix, it is always less than or equal to. Any data will be less than or equal to and more than. It is not more than or equal to. Okay, so in vulva and cervical cancer, it is less than or equal to. So size will be less than 2 centimeter and stromal invasion. That means if there is a growth, that growth has invaded into the stroma. So the stromal invasion will be less than or equal to 1 mm. That is stromal invasion is less than or equal to 1 mm. Size is less than or equal to 2 mm and stromal invasion is less than or equal to 1 mm. In stage 1B, it is more than 2 centimeter, size is more than 2 centimeter, and stromal invasion more than 1 mm. So it is, so for example, if tumor size is 2.1 centimeter, then it is 1B, more than 2 centimeter. If it is 2 centimeter, then it is 1A. Like that, if 1.1 mm, then it is 1B, because it's more than 1 mm stromal invasion. If it is 1 mm, then it is 1A. So remember that. This is important question. Next, so tumor size less than or equal to 2 centimeter. less than or equal to 2 centimeter, and stromal lymph node less than or equal to 1 mm is 1A, and in 1A there is 0% chance of lymph node involvement, and in 1B it is less than 1% chance of lymph node involvement. Then coming to advanced vulvar cancer, that is stage 2, 3 and 4. In stage 2, I have told that any time of any size of tumor that involves the lower one third of the vagina, anus and urethra with no nodes, negative node. If the tumor involves the three important structures, the three important structures are here. This is the vulva, this is vagina, this is urethra, and this is anus. So these are the three midline structures. If it is involving, then the tumor will be stage 2, lower one third. It is involving the lower one third of the vagina, anus and urethra. Then coming to stage 3. In stage 3, I have told you, if it is involving the, see, this is vagina, this is uterus, and this is bladder, urethra, and this is rectum and anal canal. So if the tumor is involving lower one third, then it is stage 2. If it is involving upper two third, then it is stage 3. Upper two third means that is it will involve the bladder mucosa, it will involve the upper two third urethra, vagina, and this is anal canal, so this will be rectum. So lower one third will be stage 2 and upper two third will be stage 3. So you have to remember this. So 3A is upper two third of vagina, anus, urethra, rectal mucosa and bladder mucosa with or regional lymph node metastasis of less than 5 mm. See, here it is also less than 5 mm, less than or equal to 5 mm. Regional lymph nodes means that means inguinofemoral lymph nodes for vulva, inguinal and femoral lymph nodes, that is called inguinofemoral lymph nodes, that is less than or equal to 5 mm. If tumor of any size with regional lymph node mets is more than 5 mm, that is 3B, and C is regional lymph node mets with extracapsular spread. What do you mean by extracapsular spread? Extracapsular spread means we have taken a biopsy, we have taken the surgery, done the surgery, and from that surgery we have taken the lymph nodes, and from that lymph node we do a biopsy, and from that biopsy we have seen that the tumor has come to the capsular spread or capsular surface. That means if the tumor comes over the capsular surface, that means that is called extracapsular spread. So it will be stage 3C. So from the biopsy we have in the slide we have shown that the tumor has involved the capsule of the lymph node, that is extracapsular spread. Then stage 4 is tumor of any size that is fixed to bone. So there is a tumor, this is the vulva, urethra, vagina and anus, so this is the perineum, and the tumor has fixed to the underlying pubic bone. So tumor is fixed or lymph node is fixed or ulcerated and distant mets. So for 4A, disease is fixed to the pelvic bone or fixed or ulcerated lymph nodes, then it is 4A. And if distant mets means pelvic or extra pelvic lymph nodes. For example, I will say external iliac lymph node involvement or para-aortic involvement, then it is 4B for vulval cancer, but it is 3C in case of cervical cancer. So remember that for vulval cancer, para-aortic, pelvic and extrapelvic lymph nodes will be stage 4B. So regional lymph nodes for vulvar cancer is inguinofemoral lymph nodes. So it will be for external lymph nodes, external iliac or internal iliac lymph nodes, and para-aortic will be 4B. 4B for vulval cancer. And if the disease is fixed bone or fixed or ulcerated lymph nodes, then any tumor of size will be 4A. So most important thing will be stage 3 A, B, C. Again I am telling 3A is upper two third of the vagina, anus and urethra, bladder mucosa and rectal mucosa. So remember, bladder mucosa and rectal mucosa is 3A in vulval cancer. but it is 4A in cervical cancer, CA cervix. So it is 4A in CA cervix, but it is 3A in vulval cancer, and regional lymph node metastasis of less than or equal to 5 mm. So this is all about vulval cancer. So stage 1 is confined to vulva, 2 is tumor of any size of involving lower one third of vagina, anus and urethra with no node. 3 will be any size with involving the upper two third of. So I have told that upper two third part is stage 3. Upper two third of vagina, anus and urethra, rectal mucosa, bladder mucosa with regional lymph nodes, that is inguinofemoral lymph nodes less than or equal to 5 mm. B will be regional lymph nodes of more than 5 mm, and C is C for, remember C for capsular, extracapsular spread. C means extracapsular spread. And 4 means fixed tumor or fixed lymph nodes. So fixed to bone or fixed lymph node and distant metastasis. 4A is fixed tumor or fixed lymph node, ulcerated lymph node. 4B is distant mets or pelvic or extrapelvic lymph nodes. That is long liver bone also, stage 4B. So this is all about staging of vulva.